Hello, everyone. I hope you guys are doing great. Uh, Thank you for showing up for this webinar arranged by my exam expert on USMLE. Um, I'll briefly introduce myself. My name is Dr. Taha. I'm an international medical graduate. It's United States Medical Licensing Exam Step on Step 2. I'm ECFMG certified. I'm currently working as a medical officer at NIRM, and I'm also working as a mentor and moderator at MedExam Experts for their USMLE course. We will, so this webinar will have two sessions. In the first session, we'll talk about uh, the basic strategies for USMLE. We will also use this opportunity to basically highlight or highlight the features of our regular course, the course that MedExam Expert offers to the USMLE aspirants. And we will, in the second half, we will try to cover a high yield topic called adrenal insufficiency. And by doing so, you will get an idea about how we do things and how we conduct our sessions. So, and if you have any questions during this webinar, you can straight away ask me. You don't have to wait for the end. You can just raise your hand, or you can type your questions in the chat box. And without wasting any more time, we'll start. So basically, obviously, if you're showing up for this webinar, you are interested in USMLE and you know what USMLE is. So USMLE is United States Medical Licensing Exam. In order to practice in USA, you have to clear USMLE, regardless of your country or region. So USMLE comprises of three steps: Step 1, Step 2, and Step 3. In order to match for residency, you just have to clear Step 1 and Step 2. Step 1 is more basic sciences oriented, and Step 2 and Step 3 is more clinically oriented. Now, there have been a lot of changes recently. Step 1 is now pass and fail, and because of that, people don't usually invest much time in Step 1 because they don't really need those high scores like 260, 270 to stand out. So that's why they rush Step 1, and that is a very huge mistake because Step 2 is basically 60% Step 1. Step 1 is your foundation upon which your Step 2 builds, and same is for Step 3. So Step 1 is very crucial. You cannot go wrong with Step 1. And because of that reason, if you see the most recent data, you will see that now more people are failing Step 1 because of this pass and fail, because people don't really put much effort in Step 1 because they don't have to get those high scores. Um, so Step 1 is very important, and it is probably the most difficult step of all, at least for me. Step 1 is very comprehensive. It takes a lot of time to prepare, and there are just so many resources out there that you have to choose. Like for Step 2, there are not many resources. It's just you will some AMBOSS and NBMEs. But for Step 1, there are so many resources. There, uh, apart from the normal question banks, there are video resources like Lecturio, Osmosis. There is BNB. There is online MedEd. So uh, it can get very daunting. It can get very uh, saturated, and it can get very tricky if you don't know what you're doing. So this webinar is for addressing those questions. So first uh, we will highlight the resources that you should use and the basic strategies that are being used for Step 1, that are tested by many students, and a lot of people have great success by implementing these strategies. So also, we will try to make this interactive. If you have any questions, you can straight away ask. You don't have to wait for the end. Again, just saying this. So, what are the first people often say, how much time do I need to ace my step one, how much time would it take to clear step two? So the answer to that is actually very difficult because no two individuals are the same. But in general, it's a safe bet to say that usually step one takes around 6 to 8 months. But still, it depends upon your base knowledge. It depends upon your study pattern. It depends upon your discipline, and it depends upon how much time are you willing to invest in step one. So, like I said, uh, there is not a single answer for this. I have seen people who have cleared their step one in like 4 months, and I've also came across individuals who took like 2 months, 2 years to take their step one. So it's a spectrum. But in general, 6 to 8 months are usually enough to pass step one if you have a sane strategy and if you don't uh, uh, dwell and if you don't deviate from your path. So usually 6 to 8 months, a very safe bet. A lot of people ace their step one in 6 to 8 months. Now, another question is, when should you start step one? When should you start preparing for step one? So the answer to that is the sooner, the better. Uh, can you hear me now? Am I audible?
Yes, Dr. Taha, you're audible.
Okay, perfect. So we were talking about the timeline and when should you start. So the simple answer to that is the sooner the better. Uh, Ideally, you should start in your medical school when you are doing basic sciences because that is the time when you are dealing with a lot of those textbooks like 𝐂𝐿, Patoma, you are doing biochemistry. So you are actively learning those concepts. And if you start, uh, if you start at that time, you won't have to put extra effort for memorizing those stuff. But that is not the case for a lot of individuals, especially for people like me. And usually in South Asian countries, people usually pursue step one during the end of their medical school or after their house job. Like I gave my step one after my house job. So house job is basically 1 year after your graduation. So I started my journey after my graduation, and because of that I had to do a lot of different things. My basic sciences were strong, but uh, because a lot of time had passed uh, uh, during my graduation, I had to go back to those basic concepts, and it took a lot of time. So uh, depending upon where are you in your journey right now, your strategy should basically adapt to that. Now, Dr. Subira says, any strategies for old IMG? I'm a post MD IMG. Thank you. So, ma so if you are an old IMG, first of all, it doesn't matter whether you're old or new. You would still need to do all the basic sciences like the new student. So if you're an old IMG, take your time. It will be difficult for you because you'll have to go through those especially biochemistry is actually very tough. It's just brute memorization, uh, very basic concepts that you don't really memorize when you are practicing medicine. Clinically, they are not very important, but for basic sciences, you have to go through those concepts again. So if you're an old IMG, uh, you should know that it will be a little difficult for you because you'll have to go through those concepts again. So it might uh, take you like for if someone is doing step one in 6 months, it you might take 8 months for step one. But trust me, there is no harm in it. You are already an old graduate, so your year of graduation should not be your current concern. The only way you can fill that gap is by scoring a very high score in step one. So time should not be uh, time should not be your concern. you should invest as much time as you can because you want a great score. Because if you are an old IMG, you need to stand out from the rest. So a good step one. So step one is basically pass fail. So a good step two score is one thing that can make you stand out. So in order to get a good step two score, you need to get a very strong foundation for step one. So step one, again, step one is the foundation. Step one, uh, you cannot sleep on step one. You have to go guns blazing on step one. So if you are an old IMG, I think you should definitely start with first aid, but no, step first aid is a review book. You will need something to back first aid, and for that, there are very good resources like BNB is very extensive. It has like even if you're starting from scratch, or some people say that even if you're not a medical student, if you start doing BNB, eventually you'll be able to A step one because it is that extensive. It covers almost everything. So if you're an old graduate, you will need some other resources to back your knowledge gap. So BNB is one very good resource. Kaplan videos are another very extensive resource that a lot of old graduates use because it has a lot of its videos are relatively more simpler than or more plainer than BNB. A lot of students have mentioned that they find Kaplan more easier than the BNB. But again, it is an individual opinion. It might be different for you, so you can try BNB or you can try uh, Kaplan, and you can see it for yourself which suits you better. So if you're an old graduate, you will need those videos. So that's one thing you should keep in your mind, and you should know that you will take a little more time than rest of the individuals. So that's that. Okay. So now we were talking about first aid. So I'm sure you have heard it before. First aid is considered the Bible of USMLE, and it is so true. Like if there is one book that covers everything, it's first aid. It is that good. And I usually tell people that you don't even need an other book or any other resource apart from the NVMEs and the question banks. First aid in itself is very extensive, and it basically covers everything. Everything that is written in first aid is gold. You have to memorize that. But the thing with uh, uh, the thing is that first aid is a review book. Uh, if there is a knowledge gap, it will not be useful for you. If you have some knowledge gap, uh, if the concepts are not fresh for you, it will be difficult for you to review the person because it is a review book. Like let's say that you open cardiology. There is this topic called heart failure. So first aid has a very beautiful section on heart failure. On just on like one page, it covers both the diastolic and systolic heart failure, and it tells you everything that you need to know. But if you don't know the pathology, the physiology behind the heart failure, it will be difficult for you to grab all the things that are written in the first aid because the those things are just facts. First aid doesn't give you that story that you need to understand a topic if you're doing it for the first time. So if you're doing something for the first time, step first aid will not help you, and that's the thing that a lot of people finds very frustrating because they hear that first aid is the Bible of the assembly. First aid is this. First aid is very important, but then they start doing first aid, and then they say that it's not helping them. They are not retaining anything. They are finding it very difficult. It is they are finding it very difficult because first aid is a review book. It's not a book that will explain a lot of these concepts to you. Uh, that's why you need something to augment first aid, and that's where these resources come, uh, like BNB, like Kaplan, like online matter. So if you are a very old medical graduate, you should you should use these resources, at least Kaplan, BNB, or even online method has a very precise video section on step one. If you're an online IMG, because you will need those videos to grab those concepts. Now, if you're someone who have just graduated, or if you're someone who is like in medical school, I don't usually recommend BNB and Kaplan because they're very extensive and they take a lot of time. Like every video is around 15 to 20 minutes, and there are a lot of topics. So it will take an eternity to cover all those topics if you aim to sit in your exam in like 4 or 5 or 6 months. So like when I was studying for my step one, I was going through first aid. So what I would do is that I would go through first aid, and if I knew the concept, that's fine. I would just revise it. But if there was something which I was finding very difficult, instead of doing BNBU and instead of doing Kaplan, I would just go to YouTube, type that topic, and write USMLE step one after it. So the if that gave me a lot of videos, so I would choose videos which were very short. And usually there's tons of stuff out there on YouTube on step one. So what I did was I would just topics that I would find difficult or I would not be comfortable with. I would just go to YouTube, find a very short video on it, watch that, and then come back to first it. If and usually that did the trick for me because I was still a very young graduate. My concepts were not that weak, and my basics were not that bad. So that saved me a lot of time. I completed my first aid and I also addressed my weaknesses by applying this strategy. So that is one strategy that works for people like me who can't invest much time on Kaplan, who don't have much time for PNB. So if you are someone who is like me or who is very new, who cannot invest that amount of time on first aid on these videos, you can apply this strategy and it works wonderful. It worked perfectly for me and it could work for you. So that's how you basically do the first aid. Remember, it's a review book. It is not a resource that will cover your knowledge gaps if your concepts are weak. It will not give you those explanations that you need if you are reading for the first time. So that's first aid. Now, I'm sure you have heard this mnemonic or UFAP. So the resources for step one, UFAP. So UWorld, that is a very, very extensive question bank. Then Petoma and first aid. So these three resources are usually enough if your if you if your foundation is solid, if you're new, a new grad, if you're a new graduate. So coming to the question banks are the heart of your journey. Even if you know everything, uh, doing questions can be tricky. Uh, if you know rheumatic heart disease, you know everything about rheumatic heart disease, but you haven't done questions from UWorld or AMBOSS. Trust me, you will find it very difficult because doing questions is a completely different thing than understanding a topic or understanding a concept. So the more questions you will do, the more you will understand the pattern. The easier it will be to basically attempt those questions in the real exam. So doing questions will be the key, and you have to do a lot of questions, a lot of questions. And these question banks, like I said, these are the heart of your journey. This journey, these are very, very important. So choosing a question bank is also very important. Now, previously uh, there were very few uh, like question banks. Like UWorld was the undisputed king. It still is, but uh, still there were not many resources. But now there are many resources out there, and they are almost equally good. So the two that stand out for the most are the UWorld and the Amboss. So Amboss is also very extensive, and some people find Amboss better than UWorld, especially because Amboss has a library and it is very extensive. So these two are the main question banks. So if you have time, you can do Amboss, but ideally you should do UWorld first and then switch to Amboss if you have time. Now there is USMLE RX. So it is a very short question bank that is basically written by the same people who wrote first aid. So that is also one thing that you can explore. So if you have time, you should do as many questions as you can, but you don't need to do these new question bank. Like Tuyo has a new question bank, Osmosis has a new question bank. So these question banks are very new. There is no good data on it. So you should avoid these newer question banks. And if you have done Jewel, you're fine. And if you have some time, you can do Amboss as well. So Amboss and Jewel covers it perfectly for you. You don't have to look for anything else. So Jewel, Amboss, these are the main question banks that you should be focused on. Now, another very important thing. So if you're doing a question banks, how should you proceed? How should you approach the question bank? Now, in UL, you can do your questions system wise or you can do it randomly. So a lot of people say that we should not be doing questions system wise because it creates a prejudice. Like if you're doing questions from endocrinology and you'll see the options now in the back of your mind, you know that these questions are from endocrinology. So there is this bias in your mind. Your observation is a little skewed, but trust me, you cannot be farther from the truth. You have to do your question bank first system wise because by doing these question bank system wise, you will see the pattern. You will see how, like, if you're doing cardio questions, you will see a pattern to the cardio questions. You'll know that if there, if this, if this is the question, this is cardio question. Like, uh, this question is shouting cardio, even though there are points on pulmonology, points on endocrinology, but this is a cardiac question. So if you'll do your first pass, like when you're doing the question banks for the first time, it should be system wise, because by doing so, you will realize how a system usually presents itself in the real day. Like you'll know that this is the cardiac question, this is the pulmo question, this is the endo question. So your first pass should be system wise. And once you're done with your first pass, you can do a second pass. But usually people say it's a waste. You should only do your wrong ones or the questions you have marked. So if you're done with your UR, you will have a lot of wrong questions, and you will mark a lot of questions. Now, you should mark every question that was not that you were not sure, even if you got it right. But if you were unsure, you should mark that question. So by the time you are done with your U work, your first pass, you will have a lot of questions which were wrong, which you did wrong, and a lot of questions which you marked. So in your second pass, you should do randomly. So your second pass of your question back should be random, and it should be timed. Because now in your second pass, you are done with your prep. Now you're just giving uh, you're giving it final touches, and now you're preparing for the main exam. Again, another important point is that UWorld is the test technique tool. It is a learning tool, right? It is not something that will predict your uh, exam outcome. So a lot of people they get panicked when they see that like they're doing only 30% right, getting 30% questions right, 40% questions right, 50% questions right. They are like, um, Dr. Taha, what do we do? We are not getting questions right. So, what I tell these individuals that you don't have to panic. It is a learning tool. Uh, if you are getting it wrong, you should know why are you getting that question wrong. It will not um it will not tell your outcome. It will not predict your outcome of the real deal. To predict your scores, they are self-assessments. That are different things. We'll talk about that. But UWorld and Amboss, these are learning tools. You should learn from these questions bank. And if you're getting questions wrong, that's fine. You should work on those questions. You should know why are you getting those questions wrong in the first place. So your question banks is a learning tool. It is not a predictor of your exam score. Now we've talked about question bank. Now when should you stop doing the question bank? Now I want you to know that you should not be doing UWorld or AMBOSS in your final months or in your final month or in your final weeks of your exam because you will, since it's a learning tool, it tricks you because it wants to make your concepts very clear. And because it is tricking you in almost every question, you are constantly thinking about it like it is wrong, it should not be like that. Your thinking pattern is different for you. But UWorld is not USMLE Step 1. You should not be doing UWorld in the later stages of your preparation. In the later stages, it should all be NBMEs, NBMEs and NBMEs. So NBMEs are self-assessment that are created by same people take who basically make the USMLE Step 1. So these NBME assessments are a very good predictor of your test outcome. And it's also a very good way of testing your weak points, like the topics which are more frequently showing up in the NBMEs, in the NBME self-assessments. Chances are that these topics will show up in your exam. And because USMLE course is very extensive, there is no clear outline. So like if you're studying cardio, anything from cardio can show up. But when you'll do these NBMEs, you'll realize that there are some topics that are more uh, harped on, that more frequently shows up. So NBMEs, in your final stage of preparation, you should only be doing NBMEs. You should not be doing UWorld because it will trick you, and you will develop that thinking pattern that you are being tricked constantly, and you might uh, do something stupid in your exam, and it happened with me. Like I was scoring. Step one was a breeze for me because I spent a lot of time. I spent a lot of time preparing for step two. Step one, even step two was uh, it did not felt very difficult, and I was consistently scoring around 260 to 270s. But my real score was a bit disappointing. It was around 257. Like I dropped 7 to 8 points from my assessments. And the reason for that I could not find a earlier date for my exam. I was done with Amboss, I was done with Jewel, I was done with NBMEs. Now, what I did was I used these new self-assessments like Lecturio, uh, Osmosis. So they usually give pre self-assessment packages in order to advertise for their question bank. So I was free. I took those assessments, and it kind of changed my thinking pattern. So and it basically confused me a little. And I did these assessments like in my final week of exam, like 3 days back. I did lecture self-assessment and it was very stupid of me and it costed me like I dropped 5 7 easy, very easy questions which I would never do, which I would never lose in my sleep. Like they were very straightforward simple questions, but because I saw questions like those in these self-assessment and those questions uh, had a trick to it. So uh, my brain thought like there has to be some trick in this question. It should not be that straightforward. And because I was thinking like that, I ended up messing those questions up. So you should not be doing new self-assessments like lecturio, osmosis. You should not be doing a U-World in the final stages of your preparation. In your final stages, you should only be focused on your NBMEs and topics you feel like you are not very comfortable with. Are you providing step two, step three as in courses? Right now, we are just focused on step one, but step two, we are also working on step two as well. But for now, it's just step one. Now, how to make notes? Should we just add to first aid? Now, I'll give you my own experience and what I did. Now, what I did was I would first read first aid. Like if, let's say I was doing cardiology, I would just read cardiology from first aid. Now, it would take uh, a day or 2 days max for just reading through reading through the first aid. I would read the first aid. If I find something difficult or if I find something uh, which I was not comfortable with, I would just straight away go to YouTube, watch a video on it, and then come back, make a note on it. Now, after reading my first aid, I would do the same system from U. Like if I was reading U first aid cardiology, I would after finishing first aid cardiology, I would start U World cardiology questions. Uh, when I would start U World cardiology questions, and when during doing those questions, obviously I would get a lot of questions wrong and a lot of questions which did not make sense. So I would write all my wrong questions on my first aid uh, cardiology section. So I was continuously making notes of my wrong ones and continuously making notes of my weak points. So by the time I was done with UWorld, I had this first aid which was very specific to me, and it had all the notes, it had all my weaknesses in it, and it made revision very easier because I knew which topics were uh, my weak points, and I knew my wrong ones. I had all my wrong ones at the same place. So uh, that's one way that you can use your first aid. You can use it as a notebook as well, and it will create your personalized notes which will have all your weaknesses. Now a lot of people use these online notes that has annotations of you word and boss in it, but I don't usually recommend those because they are just general. They carry a lot of things. It's not tuned to you. So if you are making your own notes, it is very specific for you, and you don't have to read everything that you already know. So that's one way you can use your uh, first aid. You can annotate your wrong ones from your question banks to the first aid, and by the time you be done with your first aid, you will have your personalized notes which will have all your weak points. So that's one way you can do it, and that's how I did it, and it worked perfectly for me. Now, how to do NVMe self-assessment? Need to register on the website. Now, obviously, you should, if you have resources, you can buy these self-assessments, but you can find offline NVMEs anywhere, like on Reddit, Telegram, or like platforms like uh, Exam Expert also have self-assessments. So you can find these self-assessments, offline self-assessments anywhere if you have an internet connection. Now, one more thing before we move forward, if you're doing self-assessment, make sure that you're doing it in a test at under very strict environment. Like you're doing it timed and you are doing it as if you're doing the real exam. There should be no distractions. You should not have your cell phone with yourself. You should not take a long breaks. Like you should create an environment that is very similar to the real test taking environment. And trust me, a lot of people make this mistake. They do their NBMEs very casually and they score like very good in these NBMEs because they're there is no stress on them. There is no time. Uh, uh, there's no time anxiety. There's no test anxiety because they're taking it very casually. But trust me, when you are taking these exams under those test taking environments, your outcome becomes very different because you have test anxiety, you have to manage time, you have to manage stress. So the more you'll adapt yourself to those test taking environments, the more you'll find it comfortable to perform and the more you'll find it comfortable doing your real exam. So do your NBMEs very strictly, do it timed, and you should not have any distractions with you. Cardio in 2 days is crazy fast. It takes me at least a week to complete the chapter. Again, it can be variable. No two persons are the same. Cardio was my strong point. That's why it was relatively easy for me. But again, I just did cardio first aid in 2 days. Like I read first aids from cardio, first aid cardio in 2 days. I did not completed the U World in 2 days. So that takes time. So that's one thing. But again, ideally, I think you should read at least 15 pages a day, because if you're doing 15 pages a day, you will complete first aid in around 2 months or 2.5 months. That's that. Now, finally, this Jew world, we have talked about self-assessment. Now, there is finally, we'll address there's Pathoma. So Pathoma is also a very great resource. It's a very short book. I didn't even use Pathoma videos because the textbook was sufficient enough. And trust me, it is a very, very beautiful book. Uh, you can read Pathoma in like a week. The whole Pathoma, you can do whole Pathoma in a week. And you should read it like don't read it as if you're reading a textbook. Read it as if you're reading a story. Because when we're reading these novels, when we are reading, like if you're someone who reads a lot of mangas, so we remember like One Piece has, if you're an anime fan, you know that One Piece has around 1100 episodes, and everyone who watches One Piece, you can name a sequence and they'll tell you that how yes that happened in chapter this, because it's they find it very interesting and they're not stressing when they're reading or watching that stuff. So if you watch it or read very casually these textbooks, I think it will be easier for you to retain that knowledge uh, if you're reading it as a story, or if you're reading as a novel. So that's one thing. If you're going through these textbooks, you should not be very stressed. You should be just reading it as if you're doing uh, if you're reading a novel or if you're reading some cool textbook. Now, uh, that's Patoma. Any specific chapters that we need to concentrate for? Now, the general pathology, the first four chapters are very important. You cannot skip those. At least read those for at least read those four chapters. You can skip systems because you're already doing systems from first aid. You're already doing keyword. You're already doing all the question banks as well, and like NVMe. So you can skip systems, but you should not be skipping the general pathology section, which are, I think, the first four chapters from Pathoma. Now, people talk about Sketchy and all these resources. I personally do not recommend Sketchy because Sketchy and other sources like that, they add another layer of memorization. Like if you have to memorize, let's say Pseudomonas, you'll have to memorize a picture on Pseudomonas, then there will be a story to that picture, and then there will be a mnemonic. So you see there are layers of memorization. You instead of just memorizing the main points on uh, Pseudomonas, you are memorizing all these things. So it works for few people, it works for some people, but for me it did not work, and I did not even bother for sketchy micro, sketchy pharma. I did not do it. First aid is enough. Like first aid microbiology section is such an ace. Like if you just read first aid microbiology section, I'm sure you'll get like 95% of your questions in your real exam right. When I was doing when I said in my step, it was in 2023. Uh, I remember I did not miss a single question on microbiology, and I was very stressed, because I did not do any sketchy. I did not do anything else than the first aid for microbiology. I only did microbiology from the first aid, and I only did pharmacology from first aid. I did not use any other resource, and I did not. I don't think I got any question wrong or anything. I don't think there was anything which I was not familiar with. First aid is that wholesome, and it is that extensive. So that covers your sketchy as well. Is Patoma like captaincy? So Patoma is a book by Dr. Sattar. It is a very famous book. I'm actually surprised that you don't know about Patoma. So Patoma is a very, very like famous book. It's like very short book, and it has this textbook, and then it has these videos. So every topic is augmented by these videos. So if you buy the original book, you will get access to Patoma videos. So it's both. You have textbook, and you can get explanation from video series as well. So Patoma has both videos and textbook. I did not do videos because I think I did not needed it because textbook was enough, and had already done a lot of these basic sciences. So I did not required these videos, but they are very like precise, and a lot of people do recommend it. So if it is something that concerns you, or if it's something that you want to try, you should try it. You should definitely try it and see it for yourself that whether you want to continue these videos, or the textbook is enough for you. And yes, it contains a lot of systems. Not all the system, but it has two sections, like general pathology. In general pathology, there are these concepts on tumor suppressors, metaplasias. The basic pathology concepts are in the first sequence. And then in the second sequence, it is specialized pathology, system-wise pathology. Okay, so that was on the resources and how should you approach your basic uh, 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 how should you uh, look at these resources. Now, quickly, I will use this opportunity to highlight our med exam course, like what are the highlights of our uh, regular course that we are providing. We did a crash course. A lot of people registered with us. Now, we have a group, uh, which I will add its link in the chat box. It's a free group, and in that group, I we upload questions like 4 questions, 3 questions, 5 questions that are very high yield and that are very USMLE step one-ish base. We upload those questions daily or alternately, and then we write explanations for those questions as well. And there's a lot of discussion that goes on in that group. So I invite you all to join that group. You'll find it very helpful. So join our WhatsApp group if you're interested in things like that. Now, quickly, we'll talk about our Med Exam Expert course highlights. So, it's a 6 month course. It's a very extensive course. We have a lot of talented mentors on board with us. Now we have first aid. We have these more than 36 live sessions that cover the whole first aid. And these live sessions, there is a lot of interaction that goes on. We also have these live question and answers sessions. And then if you are unable to attend these live sessions, we also have recorded series. So if you sign up for this course, you will get access to all the video series that we make for this course. Now, apart from this, Med Exam Expert is it's an online uh, educational platform that focuses on medical education. It previously covered PLAB, is very famous for PLAB, for Australian licensing exam as well. But USMLE is relatively new. It's a new project of MedExam Expert. So even though this project is new, but it has a lot of experience by covering PLAB, by covering ASMLE. So this we also have a free high yield library. So if there are some topics that you find difficult, or you just need something, like if you don't find the language very comfortable, you can look that topic in our library. You might find that topic in our library. It's very extensive library that anyone can use. And then there's this daily group discussion that happens in our WhatsApp group. We make USMLE Step 1 style questions uh, in that group. You can check that out yourself. So these are the highlights of our regular course. If you want to know more about it, you can reach out to our moderators. Now, going to the next session of our this webinar, we'll cover a very high yield topic that frequently shows up in the USMLE Step 1, called adrenal insufficiency. So we frequently talk about Cushing disorder, Cushing disease, which is basically excess of these adrenal hormones, mainly the cortisol. But adrenal insufficiency is something that is not that does not get much attention. So we decided to make a short lecture on uh, adrenal insufficiency. Sufficiency, sorry. Now, if you have any questions, you can ask me before we move forward. I think using ChatGPT is better than watching video lectures. It is better, but you should be very careful while doing ChatGPT, because ChatGPT is it a lot of times it generates reference which are not true, and a lot of times it creates scenarios which are not relevant. I myself use ChatGPT while doing my step two. I created high yield points or topics, but a lot of times it tricked me. The information it gave me was not right. So you have to cross check. You have to double check. You can use Chat GPT. It's much faster. It's more to the point, but you should always double check. So that's why you won't see people uh, referring or people advertising for ChatGPT for these exams, because it's not uh, uh, peer reviewed, or it's not foolproof. So if you're using ChatGPT, you should be careful and you should always double check. But yes, you can use ChatGPT. Petoma, pharmacology, Kaplan, first aid, is this order okay for any system? Uh, I mean, you can, by all means, you can use any sequence that fits you. Petoma is fine. You can first do Petoma, then you can watch Kaplan, and then first aid. So it's not just one thing that you should. It's not uh, like written in stones that what should be the sequence. You should try any sequence that fits for you and that you find uh, easier. Mailman PDFs are also but you should be doing Mailman PDFs at the very end of your exam. And one more thing, that Mailman creates PDFs from NBMEs. So if you read Mailman PDFs and then do your NBMEs, you will artificially inflate your scores, because Mailman basically just create those points from the NBMEs. So if you read those PDFs and then you go to your NBME self-assessment, you might just get those questions right just by memorizing the PDF instead of thinking or brainstorming that question. So Wheelman is very goated. You should check his stuff, but do not do his PDF doing uh, before doing your NBME self-assessment. You can check those PDFs after you're done with NBMEs, because it's a very, very good summary of these NBMEs. Now, now we will quickly talk about this topic called adrenal insufficiency. Now, before talking about adrenal insufficiency, we'll quickly talk about uh, what is basically adrenal gland and what are the basic pathology and physiology behind it. Now, we know that adrenal gland is a suprarenal gland. It consists of two parts, the adrenal cortex and the adrenal medulla. Medulla basically release the catecholamines. We are not concerned with that part. We are concerned with the cortex. Uh, Cortex has three layers, and each layer is very specific, and each layer creates very specific uh, hormone. And you should know these layers. So the cortex is further divided into three parts: zona glomerulosa, then we have zona fasciculata, and then we have zona reticularis. Now, there's a mnemonic called GFR, salt, sugar, sex. So G for glomerulosa, and then correspond to that we have salt. So zona glomerulosa releases uh, mineralocorticoid, which is basically or aldosterone. Then we have GFR. So for F we have fasciculata and salt sugar. So sugar corresponds to cortisol. So zona fasciculata basically release cortisol, and that it is a very important. And then the most inner layer is the reticularis. It basically produces the androgens, mainly the DHEA. So these layers are important, and each layer produces a specific hormone that you should know and that you should memorize. And also, before going through the adrenal insufficiency, I think you should know what's the hypothalamic pituitary axis, HP axis, hypothalamus pituitary adrenal axis. Uh, the initially, or hypothalamus releases corticotropin releasing hormone. It acts on the pituitary gland and causes the release of ACTH, adrenocorticotropic hormone. This ACTH acts on the adrenal gland, and it specifically acts on the zona reticularis. Sorry, zona fascicularis, the layer that produces the cortisol. So this ACTH acts on the zona fasciculata of adrenal cortex and causes the release of cortisol or glucocorticoid. So this axis, this pathway is very important because this pathway is only concerned with the cortisol. Now, aldosterone regulation is different. It does not involve the hypothalamus pituitary axis, and that is very important concept because when we are dealing with adrenal insufficiency or we have to divide it by primary adrenal insufficiency or secondary. And by secondary, we mean something is wrong with either the hypothalamus or something wrong with the pituitary. Now, this when we have something wrong with the pituitary or hypothalamus, your cortisol basically goes out because it is being regulated by this hypothalamus pituitary axis. But the aldosterone stays the same. It does not affect the aldosterone because aldosterone is being regulated by renin-angiotensin system. So that's why the physiology is very important. I always say that you have to ace the physiology and then pathology because you have to first, if you know the physiology, only then you can tell what is wrong with this individual. So if you don't know the physiology, you can know the pathology. So don't sleep on these pathways. These are very important. Don't sleep on the basis. Now, adrenal insufficiency, as the name suggests, or adrenal gland is unable to produce hormones. Mainly, we are concerned about cortisol and aldosterone. Before moving forward, again, I think you should know the functions of these hormones because if you know the functions of these hormones, you can easily diagnose the insufficiency or deficiency of these hormones. Now, cortisol is a very interesting hormone. It basically, if you know what insulin does, you can trace it back, and you can basically reverse engineer it to find the functions of cortisol, because insulin and cortisol, they basically antagonize each other. Now, cortisol functions, the important functions of cortisols are it increases your appetite. And another very important thing about cortisol is that it regulates your blood pressure. And this concept is very important. How it regulates your blood pressure? First is that it upregulates the alpha receptors, and it has a permissive effect of these uh, epinephrine, norepinephrine action on these alpha receptors. So, in the presence of cortisol, the affinity of epinephrine, norepinephrine catecholamines with these alpha receptor is much higher. So that's why we call it a permissive effect. So if there is deficiency of cortisol, there is this deficiency of this upregulation of alpha receptors, and there is this decreased permissive action of uh, these catecholamines on these alpha receptors. So if there is deficiency, obviously there will be decreased blood pressure or orthostatic hypertension as well. Another way that cortisol regulates blood pressure is that at higher concentrations, cortisol can also act on aldosterone receptor. Now we know that function of aldosterone is that it pulls sodium in and it moves potassium out. And by moving sodium in, we are moving water in. And by moving water in, we are increasing the blood volume. And if we are increasing the blood volume, obviously the blood pressure will increase. So that is the function of aldosterone. That is not the function of cortisol. But uh, at higher concentration, cortisol can also act on these aldosterone receptors and act as an aldosterone. So it can do this sodium retention and this it can cause hypervolemia. Uh, Now, why does this happen? Uh, Normally, there is this enzyme called, if I'm not wrong, 11 beta hydroxysteroid dehydrogenase. Uh, I think that's the name of that enzyme. So normally, aldosterone receptors have this enzyme, 11 beta hydroxysteroid dehydrogenase. This enzyme inactivates the cortisol, and because of that, cortisol does not bind with the aldosterone receptor. But during excess cortisol, when there's very high levels of cortisol, this enzymes get saturated and it cannot deactivate the cortisol any further. And because of that, cortisol can act on aldosterone receptor and it can increase the blood pressure. So uh, you can that's how you can talk about that's how it can regulate the blood pressure. Now, very important effect of aldosterone is its effect on or white blood cells. Now, uh, there are two things that you should memorize. It has a lot of effects on inflammatory cells, like it inhibits the functions of prostaglandins and interleukin 2. Now we know that prostaglandins cause chemotaxis. It are the regulators of inflammation. Same goes with leukotrienes and interleukin. So it inhibits the function of those. And another thing is that it decreases the white blood cell adhesion. So if there is decreased adhesion, all the WBCs, they basically you see those WBC in your blood. So even though the number of WBCs, the number of neutrophils are the same, but because there is lack of adhesion, all these neutrophils show up in your bloodstream, and you erroneously get a very high number of neutrophils, even though the actual number of neutrophil is normal. But because there's lack of adhesion of neutrophils, all those neutrophils which were lined in the cells, they are now in the blood. That's why we get neutrophilia. The thing that they test in USMLE is not WBC because it's not neutrophils, it's not these interleukins because it's very straightforward. The thing that they love most in USMLE is eosinophils and lymphocytes. Now, cortisol causes apoptosis of eosinophils. It regulates the number of eosinophils, and at higher concentration, it can also cause apoptosis of or lymphocytes, or lymphocyte numbers can also go down if the cortisol levels are very high. Why I'm telling you these things? Because if there is if that is the function of cortisol, or if this is what happens when the cortisol levels are high. Now, if we are talking about adrenal insufficiency, you will reverse these things, and you will get the symptoms of adrenal insufficiency. So these things are very important. Uh, WBCs, we've talked about WBCs, we talked about blood pressure, we've talked about appetite. Then also very important is that it decreases the functions of fibroblasts, and that's why we get in cord. So in Cushing's, we get uh, thin skin, easy bruises, and things like that. So it also cortisol inactivates or has this negative effect on fibroblasts. And lastly, another very important effect of cortisol is that it deactivates osteoblasts and upregulates the osteoclasts. So osteoclasts basically dissolve bone. And that's why we see individuals who are taking steroids for a very longer period of time, they get these osteoporosis, avascular necrosis of the bone. So that is the reason behind those diseases. Because we get these down regulation of osteoblasts and upregulation of osteoclasts. So these are the functions of cortisol. And aldosterone, as you know, aldosterone is sodium retention, potassium secretions, and also aldosterone at the distal convoluted tubule. It causes the excretion of hydrogen ion. So, in the absence of aldosterone, if you are basically not retaining sodium and you are not expelling potassium, and also you're not expelling hydrogen ion. So, these are the things that you should keep in your mind. And then lastly, there's this hormone ACTH, which is being produced by the pituitary gland. Uh, it shares a common precursor with MSH, which is melanocyte stimulating hormone. So there's a thing called propionmelanocortin. It's a common precursor that forms both ACTH and MCH. And since because ACTH um, has a similar uh, precursor with MSH at very high levels of ACTH, ACTH can stimulate the melanocyte. It basically acts as a MSH. That's why in Cushing's syndrome, we get or whenever there's high levels of ACTH, we get we get or uh, what do just we get skin pigmentation. So we get hyperpigmentation of our skin, tongue, lips. So that's why, because ACTH can also stimulate the melanocyte. So that's the logic behind it. Now, talking about adrenal insufficiency, as the name suggests, there's decreased production of these adrenal hormones. Could either be cortisol or aldosterone, depending upon whether it's primary or secondary. Now, primary, whenever there's the term primary, it means the thing that usually creates the hormone, the origin of the hormone. So for primary adrenal insufficiency, the fault has to be with the adrenal gland itself, right? And in secondary, the gland, the origin is fine, but the signaling is wrong. So the trigger signals for this is hypothalamus pituitary adrenal axis. So if there's something wrong with hypothalamus or if there's something wrong with the pituitary, it can cause adrenal insufficiency, but that is secondary because your primary organ is fine. There is a secondary disorder, which is usually pituitary or hypothalamus. Now, what are the symptoms of adrenal insufficiency? I highlighted the symptoms. That's why I was teaching you the functions of cortisol and aldosterone, because if you know the functions of aldosterone and cortisol, you can reverse those functions for this adrenal insufficiency. So, depending upon acute or chronic, the symptoms of adrenal insufficiency include weakness, fatigue, your orthostatic hypertension, you get weight loss, you have GI disturbances, you have sugar and salt cravings. Why you get sugar and salt cravings? Because cortisol causes upregulation of uh, glu- uh, glucagon, and cortisol basically increase the levels of glucose in your body. And if you're deficient in cortisol, you're not basically increasing the level of sugar, your blood sugars, and that's why you're craving sugar. Similarly, if you are deficient in aldosterone, you are not retaining salt. And if you're not retaining salt, you are basically excreting all that sodium out of your body. That's why you get the salt craving. So adrenal insufficiency functions, symptoms are very vague. It can be vague, but one scenario that stand out in USMLE is that because I've told you that adrenal gland has this cortisol has effect on blood pressure. So what they love to test us is that they'll give you an individual uh, and say that this individual has shock or features of shock, and then they'll tell you that they have tried giving him fluids, but his blood pressure was not uh, was his blood pressures did not uh, came back to normal. Then they'll tell you that they also tried inotropic drugs. Inotropic drugs are basically agents that act on your heart and increase the contraction, and that uh, causes the increase in blood pressure. And they will also tell you that inotropes also did not help. So this is picture perfect case of adrenal insufficiency. So they'll also give you a hint like this individual was on uh, chronic steroids. He was on some suffering from some autoimmune disorder, or he had some exposure to TB. Because of that, he has this adrenal insufficiency, and because of that, he was unable to perform or increase the production of this cortisol. Now, normally, what happens in these individuals is that adrenal gland is working barely, but it's still working enough to maintain the daily body requirements. But as soon as there is some trigger or some stressor, so we know that during stress there's cortisol release, and that cortisol basically helps us to cope with that stress. Now, in these individuals who have this adrenal insufficiency, they cannot whenever they're stressed, they cannot increase the production of cortisol because they are already at edge, they are already deficient. So when that happens, they get this symptoms or they get these uh, symptoms of adrenal shock and symptoms of these decreased blood pressure or systemic hypertension and things like that. This was basically adrenal insufficiency. Now talking going forward, primary adrenal insufficiency or secondary and tertiary adrenal insufficiency. Primary, I've told you that fault lies with the gland itself. So there is decreased production of cortisol, there is decreased aldosterone. Because there is decreased adrenal gland function, there's something wrong with the gland. So you will get hypertension, hyperkalemia, you will get metabolic acidosis. Why you get metabolic acidosis? Because aldosterone is not working. There is decreased secretion of hydrogen ions from the distal renal tubules, and that's why we're retaining all the hydrogen ions, leading to metabolic acidosis. Now, because there is decreased production of cortisol, we get this hyperpigmentation. Because normally what happens is that whenever there's stress, our body tries to create cortisol. How it creates cortisol? It activates that hypothalamus pituitary axis. We release a CRC, CRP, corticotropin releasing hormone, CRH, sorry, and then we release CRH causes the release of ACTH. ACTH causes the release of cortisol. Now this cortisol goes back and inhibits the production of ACTH and CRH. So there's this negative feedback, which maintains the homeostasis. In these patients, there is no negative feedback because there is no production of cortisol. So there is no switch off of the ACTH. So there is increased production of ACTH, and we know that ACTH has similar uh, precursor with the melanocyte stimulating hormone, uh, and because of that, at higher concentration, it can activate the melanocytes, and these melanocytes causes hyperpigmentation. And you see in this individual, they've shown this tongue, and there's this dark patches which are suggesting that this is some sort of hyperpigmentation. Now, Addison disease is very specific term whenever there is chronic primary adrenal insufficiency or insidious, meaning that there is ongoing deficiency of adrenal hormone, and the main culprits are either some autoimmune disorders or in step one, usually whenever they mention countries, South Asian countries or developing countries, it's almost always TB. So TB is a very common cause of adrenal insufficiency or Addison disease, or in developed countries, autoimmune disorders can cause primary adrenal insufficiency. Now, secondary, as I've told you, your adrenal gland is fine, but your something's wrong with hypothalamus or pituitary gland. Now, one more thing, in primary adrenal insufficiency, there is decreased production of aldosterone as well, because the whole adrenal gland is affected. And because of that, we get decreased levels of sodium, increased levels of potassium, because aldosterone is not working. But in secondary and tertiary adrenal insufficiency, your adrenal gland is fine, but there's something wrong with hypothalamus pituitary axis, right? So cortisol levels are down. That is one thing. But your aldosterone levels are fine, meaning you will not get hyperkalemia, and you might also not get hyponatremia. And maybe your blood pressures will also be fine in these individuals because the aldosterone is working fine, because aldosterone's regulation is caused by renin-angiotensin system. It is not caused by hypothalamus pituitary axis. And in secondary and tertiary uh, adrenal insufficiency, there is something wrong with either the hypothalamus or pituitary. Now, one another important thing in patients who are suffering from some sort of autoimmune disorders, they are usually taking steroids for a very longer period of time. And whenever we are giving exogenous steroids, these exogenous steroids basically inhibits the hypothalamus pituitary axis. And by inhibiting the hypothalamus pituitary axis, it means that body will not produce ACTH, CRH. CRH will not act on pituitary to produce ACTH, and ACTH will not act on adrenal glands in the time of stress, and it will not produce the cortisol. Now, in these individuals who are taking cortisol for a longer period of time, steroids for a longer period of time, you will also find adrenal atrophy in these individuals because they have lost the uh, stimulus of ACTH and CRH, and that's why they have this adrenal uh, hypertrophy. Hypo, not hyper. Uh, so this was secondary and tertiary. Now this is abrupt cessation of chronic glucocorticoid therapy leading to HPA suppression. This is a very important question stem. A lot of time they test you in the real exam by showing you an individual who was who just suddenly had this uh, decreased blood pressure or orthostatic hypertension, and just a very sick patient. Now they'll tell you that this patient was on steroids for a quite long period of time, and then suddenly either the steroids stopped or this patient had some stressor, like this patient underwent a surgery or this patient underwent a disease. So his cortisol requirement is now increased, but because by giving exogenous steroids, we have inhibited his hypothalamus pituitary axis, and this patient cannot increase the production of cortisol on itself. So that's why in these individuals who are taking steroids for longer periods of time or who are on steroids, whenever there is some sort of stress, you have to increase the dose of steroids or increase the dose of cortisol because these patients will need more to cope with that stress. And if you are unable to increase the dose of cortisol uh, or these steroids, they can develop Addisonian crisis and they can develop shock and their condition can worsen. So very important um question stem, very important stem that you should know. Now, another thing that they love to test us is that they often give you these arrow questions. They'll give you sodium, they'll give you potassium, they'll give you hydrogen, and then they'll tell you that this has either primary adrenal insufficiency, secondary adrenal insufficiency. You have to be very careful with these questions. If they mention that ACTH levels are if they mention that uh, adrenal gland is fine, or uh, if there is secondary, if you suspect that there is secondary adrenal insufficiency, you should know that aldosterone parameters should be fine in these individuals, because aldosterone regulation is completely different from cortisol. So do not confuse this. This is a very important, and this is a very common mistake that people do. So moving forward, acute adrenal insufficiency. So we were talking about Addison disease, which was primary adrenal insufficiency, but it was insidious, it was chronic. Acute is adrenal insufficiency. It basically, most commonly in USMLE, there is this syndrome called Waterhouse-Frederick syndrome. I'm sure if you have gone through microbiology, you know that in meningitis caused by uh, Neisseria meningitis. If that bug causes meningitis, it can cause meningococcemia. And in these individuals, there can be sudden bilateral adrenal hemorrhage that can result in Addisonian crisis. So this is one thing that you should keep in your mind. So acute adrenal insufficiency is also something that can happen, and it happens very quickly. And uh, usually these are individuals who are have some pre-existing adrenal insufficiency, and they are individuals who are already on some steroid therapies. Suddenly there is this stressor, or suddenly there is a trigger which increases their body requirement of cortisol, and because these individuals already have deficiency, they cannot fulfill that, and they result in sudden Addisonian crisis. This and this Waterhouse Federation syndrome. These two are very common scenarios that they love to test us on exam. So primary adrenal insufficiency, secondary adrenal insufficiency. Now, how will you diagnose adrenal insufficiency? Now, there is a thing called 𝐂𝐂𝐼𝐶 test. So this 𝐂𝐂𝐼𝐶, it is basically an analog of ACTH. Now, what is the function of ACTH? ACTH acts on the adrenal gland, and it causes the release of cortisol. Now, normally, either you can check levels of cortisol, the morning levels of cortisol, or you can do corticotropin stimulation test. Uh, Usually, corticotropin stimulation test is the answer in the USMLE. If you see both options like morning cortisol or 𝐂𝐂𝐼𝐶 stimulation test or adrenal gland stimulation test, choose the 𝐂𝐂𝐼𝐶 stimulation test over the morning cortisol levels, because it is more specific. Now, if we give ACTH to these individuals, what will happen? Now, either it will increase the function of, it will not increase the levels of cortisol, or it will increase the level of cortisol, right? So if it increases the level of cortisol, what type of adrenal insufficiency are we talking about? Can someone tell? Like if we give ACTH to these individuals, and after some time you see the cortisol levels are back up, what type of adrenal insufficiency are we talking about in these individuals? Can someone quickly tell? Not primary, because if we are giving ACTH and a body is producing cortisol, yes, secondary, because in secondary there is deficiency of ACTH, but our primary gland is fine. Now we have given exogenous ACTH, and this exogenous ACTH has caused the increased production of cortisol. Now, this suggests that something was wrong with either hypothalamus or something was wrong with pituitary, because it was not generating the stimulus that was needed for the production of cortisol. So this is basically, if we give ACTH and or cortisol level increases, it means that we have secondary adrenal insufficiency. Now, if there is no increase in cortisol production, obviously, then it's most likely that we are dealing with primary adrenal insufficiency. There is a very beautiful algorithm that you can all see. Uh, Wait. So if you are if you are concerned for adrenal insufficiency, you can see morning cortisol levels, or you can do ACTH stimulation test. Now, you can measure random serum ACTH level as well. So if the ACTH levels are high, very high, it means that it is not getting the feedback suppression. It is not getting feedback inhibition from the cortisol. So it means that adrenal gland is involved because it is not producing cortisol. So high levels of ACTH diagnosis is done. It is primary adrenal insufficiency. Or if there is decrease or inappropriately low or normal levels of ACTH, then chances are that we are dealing with secondary adrenal insufficiency, secondary or tertiary. So this post-entropy stimulation test is very important. Uh, and if, in order to differentiate between primary and secondary, you can straight away check the levels of ACTH. So this is basically an algorithm for diagnosing these uh, primary, secondary adrenal insufficiency. Now, treatment is simple. You give these individuals what they're deficient in. So if there's deficiency of cortisol, you give steroids or cortisol. If they're deficient in aldosterone, you give some mineralocorticoid, which is the fluorocortisone, most usually. Now, we'll do one or two questions, and then we'll call it off. So quickly read this question. A 45-year-old man presents with fatigue, weight loss, salt craving. Blood pressure is 90 or 60 millimeter of mercury. Labs reveal hypernatremia, hyperkalemia, and hyperglycemia. Morning cortisol is low and ACT is elevated. After ACT stimulation, cortisol level fails to rise. Which of the following finding would be most likely to be present in this patient? Now, I want you to answer in the chat box. Dr. Roshan says C. Why are you saying C? So this is very straightforward. Dave says that morning cortisol is low. This is obviously an adrenal insufficiency. Now we just know whether it is primary or secondary. It says that this patient has higher levels of ACTH, and after ACTH stimulation test, cortisol levels were failed to rise, meaning something is wrong with the adrenal gland. Even after giving ACTH, we were not able to produce cortisol. So this is secondary adrenal insufficiency. And we have just higher levels of ACTH. And we know that ACTH can also stimulate the melanocytes because it shares a similar precursor with MSH, which is melanocyte stimulating hormone. So at higher concentration, it can act on melanocytes as well, and that will cause hyperpigmentation. So this hyperpigmentation of Palmer cases and Buccal mucosa is the right answer. Decreased plasma renal activity. Why are you saying decreased plasma renal activity? Now, because this patient has hyperkalemia, I assume that's why. But they've clearly said that this patient has high levels of ACTH, meaning that there is primary deficiency of these hormones. That's why ACTH levels are high because we don't have that feedback inhibition. Now we'll do a few more final questions. It's an arrow question, and arrow questions are very famous for USMLE. And we'll do that, and then we'll call it off. Okay. So quickly read this question. So, if you read this question, and then they've said that this patient has fatigue, dizziness, weight loss, and generalized hyperpigmentation. Physical examination revealed orthostatic hypertension. Lab testing shows we have low levels of sodium, high levels of potassium. We have low levels of glucose, or morning serum cortisol level is low, and or serum ACTH level is high. So if ACTH is high, chances are this is basically primary adrenal insufficiency. And in primary adrenal insufficiency, what do we have in primary? We have both the deficiency of aldosterone and cortisol. Now they have given us this cortisol, ACTH, aldosterone, renin, and we have these up, down arrows normal. So you have to choose one of the options. So in option one, they have said that so now we have made the diagnosis. This is primary adrenal insufficiency, meaning we have deficiency of both cortisol and aldosterone. Now, uh, answer A, it says that cortisol level is low. So this is fine. Cortisol level will be low. ACTH level, they have mentioned this in the question that ACTH levels were high. Even if they haven't mentioned that, we know that if there is decreased level of cortisol after ACTH stimulation test, this is basically primary adrenal insufficiency. And in primary adrenal insufficiency, ACTH levels are high. So ACTH level will be high. This is correct. Now, what about the aldosterone? So this is primary adrenal insufficiency. Aldosterone levels are also decreased because adrenal levels are adrenal gland itself is not working. So aldosterone is also not coming out of that gland. So we have decreased levels of aldosterone. Now, what about this renin? Who will tell me about this renin? So, uh, a quick, just a quick hint that angiotensin, renin causes the release of angiotensin, and angiotensin causes the release of aldosterone. Now we don't have aldosterone. So what will happen to renin? Always apply these feedback mechanism loops to this person. So what will happen to renin? Can someone tell? Yes, renin will increase in this patient because there is no feedback inhibition. There is no negative feedback. Usually what happens is that we have, whenever there's decreased blood pressure, decreased renal blood flow, we have increased release of renin, right? What renin does is that sorry, what renin does is that renin causes the release of angiotensin. Angiotensin acts on aldosterone, and we have all the functions of aldosterone. And aldosterone feed negatively inhibits the production of renin and angiotensin because it is the normal homeostasis. Because we do not want continuous production of uh, aldosterone. Aldosterone, after the production of aldosterone, it does its job, and we do not need any further aldosterone. So what aldosterone does is that it gives a signal to kidney that we do not need renin. Stop the production of renin. My job is done. So this is normal negative feedback. In the absence of aldosterone, there is no negative feedback. So there will be no inhibition of renin. There will be increased production of angiotensin as well. So there will be higher levels of angiotensin. There will be higher levels of renin. So option A is the correct answer. So this is how they usually test you in your exam. They create these associations. They link one disease with the other. So these negative feedback homeostasis loops, they are more seen in endocrinology when we're talking about hypothalamus pituitary hormones and thyroid hormones, growth hormones, somatostatin. So these feedback loops are usually seen in the endocrinology. But these same loops are valid for anything in the body or anywhere in the body. So always associate one thing with another when you're doing your assembly, when you're studying for your assembly. and that's how they test us in the exam. So this was the adrenal insufficiency. If you have any questions, you can ask. Uh, and I think we're done with this session. So if you have any questions, you can ask. We have mentioned the link in the comments. You can join our group, WhatsApp group. If you have any questions, you can raise your question in that group, and I'll be happy to answer. Also, there is this discount going on from MedExam Expert. Uh, you can We have mentioned their contact if you are interested in this crash course. If you like the way if you like the session and if you want to join something like this, contact us, and we will be happy to engage with you. So that's it. Now I think we are done for today.